takes a closer look at pregnancy and a common over-the-counter pain reliever.
Health anchor Liz Bonus joins us now to tell us what new moms may want to know. Hey, Liz.
Hi, Kyle. Hi, Paula. Once again, in this study in the Journal of Epidemiology, researchers wanted to know more about acetaminophen and its use in pregnancy. Now, that is the common ingredient in many over-the-counter pain relievers such as Tylenol. They were specifically looking at whether or not its use in pregnancy could be linked to autism or attention deficit hyperactivity disorder, or ADHD.
Specialists at the Cleveland Clinic who reviewed this study and supplied this video say small amounts of this ingredient do appear to be okay. Occasional use, less than 8 days in a pregnancy, did not increase risk. The study looked at data from more than 130,000 pairs of mothers and children from 3 to 11 years out. Occasional use of acetaminophen did not appear to be harmful. Researchers did, however, see an association between prolonged use of the drug and the risk of autism and ADHD. An association, however, does not prove cause and effect. The children of mothers with prolonged exposure to acetaminophen were shown to have a 30% increased risk of ADHD and a 20% risk of autism. It is difficult to draw conclusions from this research, however, according to Cleveland Clinic specialists, because there is so much we don't know about autism and its causes. They do point out that the important thing that pregnant moms need to know is that acetaminophen is still the safest known drug to take to treat problems such as fever and pain while pregnant.
Now, the reason that's important is that a fever left untreated can be very dangerous to a mother and baby. And so there are times where your doctor will say, this is what we want you to do, this is what we want you to take. Everything is benefit versus risk, and you're protecting a life aside from your own. The problem too is that you can't study pregnant women. You can't go, here, take this, let's find out what happens. That would be unethical. So you have to do them retrospectively. You have to go out the next 10 years and ask mothers, did you take this? And then what do we see? And that means, again, an association, not necessarily a cause and effect. But because we're seeing more children with ADHD and autism, it is important to explore these, because years ago we didn't have them.
Good question.
And it makes me, think too, it's really sad. There's a lot of times the first few months you don't even know you're pregnant, and so you don't feel well, you might want to grab that. So if you think you might be starting to have a child.
We call it the 13-month pregnancy. If you're even thinking of having a baby, stay away from the stuff you wouldn't take if you were going to have a baby. Yeah, so true.